When we perform a bone marrow transplant, we are transplanting stem cells. Every type of blood cell in the marrow begins as a stem cell. Stem cells then develop into any of the three blood cells: white blood cells, the infection fighters; red blood cells, oxygen carriers; or platelets, which cause your blood to clot when there's an injury. In the early 1970s, this procedure was called a bone marrow transplant, or BMT, because the stem cell was collected from the bone marrow. Bone marrow is the spongy tissue found in the centers of bones where all stem cells are made. In the early 1990s, researchers found that the stem cell could be moved into the bloodstream. Once these blood-producing cells have been moved into the bloodstream, they can be collected for transplant purposes. After this discovery, many centers began calling the procedure a stem cell transplant, and it has been an effective treatment for various diseases. Stem cell transplant and bone marrow transplant are used interchangeably, but it's often confusing for patients. For purposes of this program, we'll be using the term stem cell transplant. There are two different types of transplants: autologous and allogeneic. In an autologous transplant, you are your own donor. Your own stem cells are collected and stored for reinfusion later. The stem cells are used to rescue your blood cells from the damaging effects of high-dose chemotherapy. The diseases typically treated with autologous stem cell transplant are lymphoma, multiple myeloma, and some solid tumors such as testicular cancer. In an allogeneic transplant, you receive someone else's stem cells. The donor can be a relative or an unrelated donor. If the donor is an identical twin, it's called a syngeneic transplant. Allogeneic transplants are typically used to treat the leukemias, myelodysplastic syndrome, and aplastic anemia. Stem cells can also be recovered from umbilical cord blood donated at the time of childbirth. When mothers donate umbilical cord stem cells, they are donated for the general population. They're collected at the time of delivery with no harm to the baby. The cord blood stem cells are then frozen and stored as an unrelated stem cell source. You may be told that you're having a non-myeloablative stem cell transplant. This is an allogeneic transplant that uses the donor's immune system to help fight off cancer. The donor's cells and patient's cells coexist in the body for a while, working together to fight cancer cells. There are many phases of the process that can take anywhere from a few weeks to many months to complete. Now we will walk you through the preparation phases as well as the transplant itself.